Welcome to our strategy series. Allow me to introduce myself. My name is Dr. Danielle Plotz, and I am a pediatric neuropsychologist at the Kennedy Krieger Institute. I work as part of an interdisciplinary team in a day rehabilitation program for children and adolescents with a variety of diagnoses and conditions, including acquired brain injuries. This video series will focus on providing educators knowledge about evidence-based strategies to help children and adolescents who have sustained a traumatic brain injury and may struggle with attention, memory, executive functioning, and emotion regulation. Those are just a few of the areas that may be more challenging after sustaining a TBI. This overview will hopefully be a starting place for many of you, and with the knowledge you have gleaned here, we hope that you will feel more empowered to help a student optimize their potential in the classroom. In this segment, I will be discussing emotion regulation and strategies to consider using in the classroom. Emotional regulation is exactly what it sounds like, the ability to modulate and regulate your emotional responses. It is part of the broader domain of executive functioning. Children that have sustained a brain injury may have more difficulty with controlling their impulses or inhibiting emotional responses. Poor emotional control can be manifested in a multitude of ways. Emotion regulation difficulty may look like somebody is overreacting, or they may have a more tearful response that seems to come out of the blue. They may also be described as being very upset over something minor, like being told to put their paper away. There may also be times when there is a mismatch between the context and the emotional display. For example, someone may get in trouble but respond with laughter. They may appear to go from a neutral, calm state to an inconsolable, irate state relatively quickly. These can be jarring to witness and certainly challenging to manage. So before I get into these strategies, I want to just briefly touch base about how we think about translation of research to practice. When defining evidence-based practice, we look at not only what research shows us is effective, but also take into account the patient and their values, as well as our own clinical expertise and experience. Unfortunately, in many of these areas to be discussed, we have limited research of these strategies within a specific population and age group, like pediatric TBI. Sometimes when we look at the evidence for treatment of a particular area of functioning, it may be heavily researched in other populations. For example, a lot of strategies we discuss for executive function problems are often utilized in those that have diagnoses of ADHD. So the strategies presented here are based in theories that may have origins in other diagnoses and are based on clinical experience in working with children following a TBI. Emotion regulation following TBI can be very disruptive to anyone's life, including making it increasingly difficult to engage in academic and social activities. There are several things to consider that may help prevent emotion dysregulation. If we think about the emotional response in terms of a challenging behavior, then we can use the ABC approach to managing the A in ABC, which is the antecedent. For those that may not be familiar with the acronym, the B then stands for behavior, and the C is then the consequence. First, it is important to develop a positive rapport with the individual. It is also helpful to provide structured environments, that is, consistent routines, provide rules and education about ways to appropriately communicate, involve the individual and/or the parents in discussing these challenges, and avoid or minimize known triggers. One example of a potential trigger that comes to mind for kids who have sustained a TBI is feeling overwhelmed. In this case, it may be helpful to have reduced demands and expectations relative to peers. Use distraction or redirection away from the trigger if possible. It will be important to know what those triggers might be. Some may be apparent after working with them. Other triggers may not seem as obvious, so having a discussion with the family and the child, if they're able to and have awareness of the triggers, may actually be very helpful. There are a multitude of strategies that are often used and taught in individual therapy sessions with children and adolescents that have difficulty with emotion regulation. It's important to know what those strategies are that the child employs and to suggest and encourage the strategies when needed. Some of these may include deep breathing, activity pacing, engaging in mindful activities, or switching to a preferred task, to name a few. It may also be helpful to use some of the other strategies discussed as appropriate to support executive functioning or memory, as an example. As you can imagine, these challenges do not typically occur in isolation, especially following a TBI. Please refer to the specific presentations for more detail about strategies for attention, memory, and executive functioning. There are several ways to support a student that is having a difficult time regulating their emotions. One key thing to remember is to remain calm. It is important to avoid reacting emotionally yourself, as this can escalate the situation. Allow the individual to have a quiet area to practice strategies they may have learned from someone, such as a behavior psychologist. Acknowledge their emotional response and allow for an opportunity, when appropriate, to talk about it. Provide feedback and support and gently redirect them to another activity or topic. Positive reinforcement is still an excellent strategy to use in conjunction with these other strategies so that the child is reinforced immediately for appropriate behaviors. For example, Kevin usually becomes quiet when anxious, then suddenly starts shouting at everyone. He is learning to tell family members when he is getting anxious and to do his deep breathing exercises. Every time he remembers to do this, his actions are praised and that behavior is reinforced. Positive reinforcement is not bribery. And of course, it's important to remember that the reinforcer be practical, ethical, and valid for the behavior being targeted. And timing is also critical to ensure that the child makes the connection that the reinforcer is the result of the desired behavior. After a TBI, a person may have more difficulty knowing and being aware of appropriate and inappropriate behaviors. They may also have difficulty interpreting facial expressions and nonverbal language. It may be helpful to provide immediate and clear verbal feedback to the individual about inappropriate behaviors. A gentle redirection can also be very effective, and particularly when it can be combined with positive reinforcement. As I mentioned previously, it's important to remain calm when there is an emotional reaction, but sometimes very tactical, specific ignoring, when also combined with positive reinforcement, can be very effective. I'd like to provide a fictional case example so you can see how these strategies might be implemented. Let's take Kevin, for example. So in this example, Kevin is a 13-year-old young man who has sustained a severe traumatic brain injury about a year ago. We know that Kevin can become anxious and has a hard time communicating his concerns. He has been known to yell or rip up assignments for seemingly no reason. So let's imagine that there is a scenario that Kevin is feeling anxious and frustrated about, and started yelling and has potentially ripped up or is about to rip up an assignment. So some questions that I would want to ask are, what do we know about Kevin's triggers? What are strategies we learned Kevin was working on to cope? And how can you support him in this moment of stress? So we know that Kevin can become overwhelmed easily with large assignments. And we know that he can become more frustrated since it is taking him longer to do things, both thinking about as well as with motor tasks. So for the large assignments, there are a lot of ways that we can attempt to mitigate these triggers by asking him to do every other problem on the page or writing one response at a time. Maybe we chunk his assignments or help him with prioritizing tasks. You can see here where we're using many strategies from the executive functioning domain, and it may be warranted, depending on his other needs, to utilize strategies for memory or attention as well. For his slower thinking and motor skills, we have given Kevin extra time, or maybe we give him alternative ways of completing tasks that accommodate his motor challenges. We also know from talking with his parents and from assessments from other providers that Kevin is working on deep breathing, activity pacing, and is learning to communicate his needs. We also know that Kevin struggles with communicating, especially when faced with the challenging task, and doesn't always think about asking for help first. In short, he has a difficult time inhibiting the more automatic emotional response of frustration or irritability. So what are some things that you can do in this moment? Well, first, stay calm. Speak to Kevin in a very neutral voice. For Kevin, we also know that he has a chart to refer to, but he needs a verbal cue to look at that chart, or he won't be able to independently choose how he can be helped. So one might gently state, Kevin, I see that you're getting frustrated. Let's take a look at your chart to help you. This visual cue can be helpful to allow the child to name their feelings, to take a mental break from whatever they're doing, and to allow them the opportunity to use some of their coping strategies or even ask for help if that is needed. As you can see from this chart, it's very brief and user-friendly. It doesn't have a lot of extra words or lengthy explanations. It's really important to be as straight to the point as possible when creating visual cues. And this can be very individualized as well. Maybe the child doesn't use the term challenged. Maybe he says or she says when she feels upset or frustrated. It can be helpful to use the language that the individual would typically use in creating these sheets. Additionally, these strategies can all be individualized for the student. And finally, in this situation, it would be important to provide feedback or reinforcement as appropriate for engaging in any of these strategies, even if it was needed to be reminded. And depending on the situation, it may be more appropriate to redirect and engage in a different activity. So, to circle back, it is important to have information about the student that can help individualize the appropriate plan for them. For example, as I'm sure you heard as I was talking, many of these areas of difficulty are complex and multifaceted. Recall from a previous presentation that no two brain injuries are the same. Not only are there individual differences in the injuries themselves, but also in terms of recovery, resources, and with the individual. There is no one solution that will work for all kids, and the answer to how best support them really does come down to understanding them fully and working with multiple parties. Since many of these children are continuing to develop and change, what works in the beginning of the year may no longer be appropriate at the end of the year. So ensuring that you are taking data on what works will be instrumental. Consider taking a look at the Universal Design for Learning guidelines. There are options related to supporting self-regulation that can help to guide this process. Teachers play a key role in helping students with TBI succeed in the school environment. The school team must work together to develop a comprehensive plan based on the student's strengths and weaknesses. With careful planning, it is hoped that your student will overcome his or her cognitive challenges through direct intervention and accommodations. Thank you for your time, and I hope you found the information helpful. If you are interested in learning more about brain injury, please go to the Kennedy Krieger Institute's brain injury website found at the end of this video. Be sure to watch our other videos for strategies for supporting attention, memory, and executive functioning. Thank you.